Quartette is a combination hormone medication that is used to prevent pregnancy. It contains two hormones, a progestin called levonorgestrel and an estrogen called ethinyl estradiol. In addition to preventing pregnancy, this birth control pill can also make your periods more regular, decrease blood loss and painful periods, decrease your risk of ovarian cysts, and treat acne. It's important to note that using this medication does not protect you or your partner against sexually transmitted diseases such as HIV, gonorrhea, or chlamydia. Before you start taking Quartette, make sure to read the patient information leaflet provided by your pharmacist. It contains important information on when to take your pills and what to do if you miss a dose. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth as directed by your doctor, usually once daily. It's important to take it at the same time each day. You can take it after your evening meal or at bedtime to help with stomach upset or nausea. No matter what dosing schedule you use, it's very important to take this medication at the same time each day, 24 hours apart. When starting Quartette for the first time, use an additional form of non-hormonal birth control for the first 7 days to prevent pregnancy until the medication has enough time to work. If you start on the first day of your period, you do not need to use backup birth control the first week. Your pill pack contains 84 estrogen/progestin pills and 7 estrogen-only pills. Take 1 estrogen/progestin pill daily for 84 days in a row. The day after you finish all the combination pills, start taking 1 estrogen-only pill daily for 7 days in a row. You should have your period during the week you are taking the estrogen-only pills. If you do not get your period, consult your doctor. If you have vomiting or diarrhea, you may need to use a backup birth control method, such as condoms, spermicide. Follow the directions in the patient information leaflet and check with your doctor or pharmacist for more details. If you have any concerns about switching from other forms of hormonal birth control to Quartette, consult the patient information leaflet, your doctor, or pharmacist for more information. Some common side effects of Quartette include nausea, vomiting, headache, bloating, breast tenderness, swelling of the ankles/feet, or weight change. You might also experience vaginal bleeding between periods, especially during the first few months of use. If any of these effects last or get worse, be sure to tell your doctor or pharmacist right away. While taking the combination pills, you should not have your period during the 3 months. Instead, you will have your period once every 3 months, during the week that you are taking the estrogen-only pills. If you do not have your period while taking the estrogen-only pills, contact your doctor for a pregnancy test. Remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. It's important to check your blood pressure regularly and tell your doctor if the results are high, as this medication may raise your blood pressure. Contact your doctor right away if you experience any serious side effects, such as lumps in the breast, mental/mood changes, severe stomach/abdominal pain, unusual changes in vaginal bleeding, dark urine, or yellowing eyes/skin. In rare cases, this medication may cause serious problems from blood clots. Seek medical help immediately if you experience symptoms such as chest/jaw/left arm pain, confusion, sudden dizziness/fainting, pain/swelling/warmth in the groin/calf, trouble speaking, sudden shortness of breath/rapid breathing, unusual headaches, unusual sweating, weakness on one side of the body, or vision problems/changes. If you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help right away. And as always, if you notice any other effects not listed above, contact your doctor or pharmacist. If you are over 35 years old and smoke cigarettes or use tobacco, do not use Quartette. Smoking increases the risk of stroke, heart attack, blood clots, and high blood pressure when using hormonal birth control. The risk of these serious problems increases with age and the amount of cigarettes smoked. It is important to not smoke or use tobacco while taking Quartette. Before taking Quartette, make sure to inform your doctor or pharmacist about any allergies you may have to ethinyl estradiol or levonorgestrel, other estrogens or progestins, or any other allergies. Also, share your medical history, including any history of blood clots, high blood pressure, abnormal breast exams, cancer, high cholesterol or triglyceride levels, depression, diabetes, heart problems, liver or kidney disease, stroke, thyroid problems, or any unexplained vaginal bleeding. If you have diabetes, be aware that this medication may affect your blood sugar levels, so be sure to monitor them regularly and inform your doctor of any changes. If you are planning to have surgery or will be confined to a bed or chair for an extended period, be aware that this can increase your risk of blood clots, especially when using hormonal birth control, so talk to your doctor about any necessary precautions. Quartette may also cause blotchy, dark areas on your face and skin when exposed to sunlight, so be sure to limit your time in the sun and use sunscreen. If you are nearsighted or wear contact lenses, you may experience vision problems or difficulty wearing your contacts, so contact your eye doctor if needed. It's important to note that it may take longer to become pregnant after stopping birth control pills, and this medication should not be used during pregnancy. If you become pregnant or think you may be pregnant, tell your doctor immediately. Additionally, Quartette may decrease breast milk production and pass into breast milk, so consult your doctor before breastfeeding. It's important to be aware of potential interactions with other medications that may affect how Quartette works or increase the risk of serious side effects. You should keep a list of all the products you use and discuss them with your doctor and pharmacist before starting, stopping, or changing the dosage of any medicines. Some products that may interact with Quartette include aromatase inhibitors, fezolinetant, ospemifene, tamoxifen, tizanidine, tranexamic acid, and certain combination products used to treat chronic hepatitis C. There are also some drugs that may cause hormonal birth control to be less effective, such as griseofulvin, modafinil, rifamycins, ritonavir, St. John's wort, drugs used to treat seizures, and HIV drugs. If you start any new drug, notify your doctor and discuss if you should use reliable backup birth control. Also, let your doctor know if you experience any new spotting or breakthrough bleeding, as these may be signs that your birth control is not working well. Additionally, Quartette may interfere with certain lab tests, potentially causing false results. Be sure to inform lab personnel and all your doctors that you are taking this medication. If someone has taken too much Quartette and has serious symptoms like passing out or trouble breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of overdose may include severe nausea and vomiting, as well as sudden or unusual vaginal bleeding. It is important not to share Quartette with others. While taking this medication, it is essential to have regular physical exams, including lab and/or medical tests such as blood pressure, breast exam, pelvic exam, and pap smear. It is crucial to follow your doctor's instructions for examining your breasts and to report any lumps right away. Make sure to keep all medical and lab appointments and consult your doctor for more details. If you miss a dose, refer to the product package for guidance. You may need to use additional birth control methods, like condoms or spermicide, to prevent pregnancy. If you have any questions, ask your doctor or pharmacist. If you frequently forget to take your pills as directed, talk to your doctor about switching to a different form of birth control. Make sure to store Quartette at room temperature away from light and moisture, but not in the bathroom. Keep it out of reach of children and pets. Do not flush Quartette down the toilet or pour it into a drain unless instructed to do so. When it's expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for more information. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.